Hello, my name is Stefan Kirby, and today I'll be presenting a full treatment plan based on the couple from the movie Marriage Story. The presentation is for ECG 530 for couple marriage and family counseling. Today's date is April 26, 2025. So let's introduce. So first there's Charlie and Nicole. In a marriage story, we follow Charlie and Nicole, a married couple navigating a painful process of divorce. Charlie is a successful theater director in New York, while Nicole is a former teen film actress who desires more independence and a career in Los Angeles. The presenting problem includes ongoing communication breakdown, unmet emotional needs, parenting conflict over the custody of their son Henry, and I chose this couple because their intense emotional conflict highlights the struggles many modern couples face when balancing property or personal identity with shared life goals. So, assessment and case conceptualization. So, Charlie and Nicole are in the launching stage of their family life cycle, focusing on redefining their relationships as co parents while coming to the end of their marriage. Strengths include a mutual love for their son and residual respect for each other's talents. Challenges involve emotional disconnection, communication barriers, and resentment. These contextual factors include cultural differences between New York and Los Angeles lifestyles, and that pressure of fame and career ambitions kind of all stack on top of each other. The key relational dynamic include unresolved power struggles, emotional neglect, and poor conflict resolution. So, diagnosis. Diagnostic impression I got would be the Z code Z63.0, which is partner relational problems. This captures the emotional distress and difficulties in the relationship while labeling either party with a mental health disorder. Formal clinical diagnosis isn't necessary unless deeper individual mental health issues surface during therapy. Another code I have is Z63.5, and this is the disruption of family by the separation and divorce, and this whole family dynamic gets separated over time. So the therapeutic approach, my therapeutic approach that I chose was emotional focused therapy, or as some call it EFT. So with this therapeutic approach, we focus on building emotional awareness and restructuring attachment bonds and fostering secure emotional connections. This model is ideal because Charlie and Nicole struggle to express vulnerability. This leads to defensive interactions, and EFT addresses developmental needs, prioritizes emotional regulation, and respects diverse cultural values. A model I would avoid is probably structural family therapy because the couple's conflict isn't primarily in the hierarchical boundaries. It's more about this emotional disconnect that they've grown over time. So my treatment goal, I have three SMART goals for them. I'll label them with improve, reduce, and strengthen. So we want to improve with the emotional attunement by identifying and expressing vulnerable feelings during a biweekly session for about 8 weeks. During this, we'll rebuild emotional safety by engaging in these biweekly exercises. Next, we want to reduce escalation of arguments by practicing structured emotional dialogue techniques during conflicts within 6 weeks. This will improve the co parenting communication by establishing that structure with these prompts that may be needed. We also want to strengthen the co parenting communication by collaborating, planning weekly path and logistics over the next 8 weeks, decreasing these escalated conflicts using these emotional regulation techniques in at least 80% of disagreements. The interventions uh, guide the couple to open, discuss past emotional hurts without judgment, promoting healing. So we're going to cycle de-escalation through multiple different ways. Through these conversations that they're having healthier ones each time. So we want to identify and interrupt the negative interaction patterns that are fueling this disconnection. So our primary secondary emotion exploration will be next. This will facilitate that deeper expression of hurt, fear, and longing instead of anger or blame. Kind of get into the root of what's really causing these other emotions. This will help them recognize primary vulnerable feelings under secondary anger or withdrawal. Next, restructuring interactions. So we're going to do softened communication exercises, coach the couple in creating new emotional responsive patterns of relating. This will teach speaking from vulnerability instead of a blame to foster connection. Each intervention directly supports the SMART goals by enhancing emotional safety, communication clarity, and conflict regulation. So the fun part, homework. So I have homework for Charlie and Nicole. Two things, emotional journaling. After each argument, each partner should journal their vulnerable emotions and share insights during the session. As they're looking at these, maybe they can dive deeper into what these emotions are and how they are affecting other emotions. We're going to do structured check-ins, weekly date night check-ins. So 30-minute non-argument conversations about twice a week, focusing on sharing vulnerabilities and setting the space aside for them to have these conversations. Non-parenting conversation prompts to rebuild friendship and emotional intimacy. These assignments reinforce emotional attunement and strengthen healthy communication habits outside of sessions. Now, what's the steps moving forward? Wrapping up therapy, success would look like Charlie and Nicole communicating respectively, co-parenting cooperatively, and expressing vulnerable emotional safety. A relapse plan would include a self-designed timeout protocol during conflicts and check-in booster sessions every 3 months. I would also encourage connection to community co-parenting classes and emotional support groups if needed so they can have other resources. To conclude, working with this couple would deepen my appreciation for the complexity of emotional wounds and relationship dynamics. I learned that rebuilding trust and vulnerability takes some time and patience. So if I had to work with them, I would integrate even earlier emotional focused intervention to prevent this escalation. This will reinforce that family therapy, emotional connection, find a foundation for healing even amongst the most fractured relationships. And that will wrap up my presentation. I thank you for listening.